Alzheimer Scotland have worked with V&A Dundee to make Scotland's first design museum as accessible as possible for people living with dementia and their carers, including developing tailored activities and delivering training for museum staff. Following the museum's opening in September 2018, Alzheimer Scotland and V&A Dundee worked together on several ways to bring creativity and culture to those living with dementia across the local area, delivering tours of the major exhibitions and object-based workshops in Alzheimer Scotland's daycare and dementia resource centres. In response to COVID-19, we explored ways of continuing this high-quality support and delivered multiple live virtual tours, including the Mary Quant exhibition and the Scottish Design Galleries, allowing many more people to take part, regardless of their physical location or ability to travel to the museum. This also reduced people's isolation and ensured they felt connected, with social opportunities offered throughout these difficult times. Alzheimer Scotland and V&A Dundee were able to take the joy and inspiration of design to people living with dementia and their carers. Digital technology also enabled rich conversations while stimulating the mind and senses and providing opportunities for people to socialise, share memories, discuss, laugh and contemplate. Following the success of the virtual tours, we developed a small programme of online activities that would bring the Mary Quant exhibition to life. The activities explored all aspects of the exhibition through presentations, a virtual walkthrough, tactile handling objects and group discussion. Handling materials were created and shared directly to participants, who could then have a tactile experience of the exhibition in the safety and comfort of their own homes. While innovative, we wanted to experiment with how a hybrid way of working could be delivered at scale, combining the benefits of digital content reaching a greater number of people with the friendliness of an in-person event. Alzheimer Scotland's newly launched Virtual Resource Centre provided just such an opportunity, and V&A Dundee was delighted to pilot a tour of their current exhibition, Night Fever, Designing Club Culture, in June 2021 during Dementia Awareness Week. This was not only a new way of working for Alzheimer Scotland, but also for the museum, being the very first in-person tour that was also broadcast live to audiences watching online. It was a huge success, with nearly 100 people watching online and enjoying the same experience as those in the galleries. The feedback reflected this, with people tuning in from as far afield as Cyprus, demonstrating the power of digital to connect people through shared experiences. Working with V&A Dundee has shown the positive impact that engaging with the museum can have, and it is something we are keen to continue and build on using a blended approach. Furthermore, additional discussions are underway that build on this work and seek to create longer-term opportunities through a collaborative partnership approach. These opportunities would both broaden and deepen the engagement carried out so far, while simultaneously exploring the role of brain health and cultural engagement in dementia prevention and care. This additional work has all stemmed from the strong relationships created and evaluation of the previous work during an incredibly challenging time, demonstrating resilience on behalf of both organisations and a commitment to support those who may have been disproportionately affected by the situation in which we are all now living. The feedback around our work so far has been overwhelmingly positive, emphasising how a hybrid way of working and a connection with culture can support the lives of those living with dementia, as well as those who care for them. As this slide demonstrates, the feedback has shown how people have felt connected, stimulated and joyful, whilst the activities have provided escape and respite for those who care for an individual with dementia, just as much as they aim to support the person with the diagnosis. At a time when access to services can be reduced and the prospect of doing things that were normal before the pandemic feel like a distant memory, Having the ability to collaborate on delivering meaningful, shared experiences is incredibly powerful. The joy of culture and human connection is more important than ever, and we can still stay connected and enrich each other's lives even when we can't always be together.